Hello, everyone. My name is Natalie Coons, and I am the president-elect of the ASA Medical Student Component Governing Council. Today, I have the honor of speaking with Dr. Oliva from the University of Colorado's Department of Anesthesiology Residency Program. Thank you so much for being here.
Welcome. It's a pleasure to be here.
So our first question is, just tell us a little bit about yourself and how long you've been the program director at the University of Colorado.
Yeah, so I'm a native of Colorado. I haven't ventured very far away. I grew up here, went to college and medical school here. I actually was part of the joint MD PhD program at the University of Colorado and then did my residency here. So I have a unique, I guess, pathway to where I'm at right now in that I really haven't been elsewhere. But it also gives me a really good insight into our program in depth because I know so much about it as well as our faculty. And this is my fourth academic year of being program director. So I have my first class that I've recruited that is in their second to last year of training. So, you know, it's good to see people that I was responsible for recruiting into the program making their way through.
Awesome, thank you. Our next question is, what do you love most about your program?
Well, I think first and foremost, I love the people. And when I say people, I think of three groups of people. I obviously think of the residents. I think one of the strengths of our program that not a lot of people realize is the people that are attracted to come into Colorado. These are people that are outgoing. They want to go out and do things on the weekends, up in the mountains, be active. But they also really are just kind people. They are people that care about one another. And so the residents really have a tight bond with each other. Their families get together. And so that's a really neat thing to be with people that are like-minded like that as you go through training, because that's a really great support network for you as you go through tough rotations. And then the faculty, I think, are a group of people that really make a big difference. Obviously, you want to be taught by people that are experts. You want to be taught by people that are of national standing and international standing. And then you want to be taught by people that really respect your status as a trainee and your development as you go through the program. And then the last group really is everybody else, the nursing staff, the surgeons, the other people that you're going to work with on a day in and day out basis. I think one of the things that strikes me, especially for faculty, is if they've trained elsewhere and we're faculty elsewhere, they'll come here and say, you know what, the surgeons are actually really nice. There's a really good relationship we have with them. There's not this kind of push-pull and antagonism that can be seen in other programs. And I think that's really important for residency training to feel that there is more of that collegiality. And so by far and away, the thing that I'm most proud about is and love about our program are the people throughout the entire institution and the program.
It sounds like an amazing environment to learn in. Our next question is, what makes your program unique?
Great question. I think that to me, there are several things that make our program unique. First and foremost is the environment that we have to train in. I think that you're going to be hard pressed to find a residency program that has all the resources and tools to get trained as we have. So we have our trainees go through 4 different sites. Denver Health is a site that is a city and county hospital. So you get to see a lot of the things that you would like to see in the indigent population, under or uninsured populations, homeless populations, things of that nature. But they also are internationally recognized for their trauma surgery. And so they get lots of trauma there. So the trauma exposure of our residents is outstanding. The other affiliates that we have a VA that's got a brand new facility. Our residents get great training there, taking care of our veterans. Our children's hospital actually just got, it's routinely ranked in the top 10 in the country for children's hospitals this year. It just came out from US News that they're number 6. So you're getting exposure to, really all of these surgical specialties that have high rankings, and people come from all over to that institution from different states surrounding Colorado. And then University Hospital has been, is always the top hospital in Colorado. It's top 10 to 15 usually depending on the year nationally as well. And so you're not going to find the conglomeration of sites to train at that has that caliber really anywhere else. And so I think those are, from a training environment standpoint, really important. Another piece of that is you don't have to compete with anybody. We don't have another program for 600 miles And so there's no competition for cases. You get the best cases at all times and the most complex cases. And I think really at the end of training, many of our residents, if they're going into private practice, they feel completely comfortable taking anything on because they've dealt with the sickest of patients in the most interesting cases throughout their training. And then, one aspect that I think is really important is wellness. In this day and age, I think a lot of students, rightly so, place emphasis on what is the program doing to promote wellness, to try to minimize burnout. Those are things that are important as a trainee, but they're important for the rest of your career as well. And so we take that very seriously. We have a longitudinal curriculum that takes place throughout training. We have residents doing retreats every year, and those retreats really focus on a multitude of things, but really trying to establish that connection between the class as well as learning tools that are going to help you for the rest of your career, really are a focus of that. And then we have, I think, something that's incredibly unique, not just for anesthesiology, but for all training programs. Our department actually pays for a clinical psychologist, and that clinical psychologist is available for debriefing of adverse events, difficult rotations, our IC rotations, where people, unfortunately have bad outcomes and pass away. That person's available for debriefings to help with some of these difficult rotations. And then on top of it, she's also there for the rest of our staff too. So I think that really bodes well for the entire department because our faculty, APPs, and residents have somebody they can go to, either work-related or completely unrelated to work as well. And then the last thing is we have physician champions that I think are super important for the wellness piece. Allison Brainerd is somebody that is very committed to resident wellness. She is nationally known for the implementation of our curriculum. And I think that that's one of the things that really makes us stand out is that we have a very well vetted and thorough curriculum. And then the last piece is something that I'm very proud of myself because it was something that when I was a resident, I saw as a need in the residency, which is that CA3 year to develop supervision and leadership skills that you're going to be using potentially as when you transition to a job. When I was a senior resident, we just really had our rotations that we did over. You had another month of CT, another month of OB, and another month of ICU. And our seniors now have a varied experience. We have a senior month that they do at University Hospital that is a week of nights where they get to run the show. They carry the trauma pager, they carry the airway pager, they carry the charge phone, and they're coordinating cases, checking on traumas down in the ED, supervising the junior resident as well as the APP at night. And then they have a multitude of other experiences that month that really give them that exposure. At Denver Health, we have an anesthesia in charge segment for their education where they're during the day, weekdays, run the show, they run the board, they help to supervise the junior residents there. And so they're getting this opportunity to really learn what it is to be faculty in a supervision model and learn how to mentor and teach junior residents, as well as learning how to be collegial with APPs and where do I stand, what do I do, a lot of these things that you wouldn't think about until you have to be put in that position. So those are the parts that I think make us unique.
That's awesome. I'm a huge proponent of mental health and wellness, so it's really great to hear what your program is doing to ensure that the residents are staying well while training. Our next question is, how do you weigh the different components of a residency application to determine who to give interviews to?
That's a question that, I was hoping Mario could go into depth about, but since he's not here, I'll make sure that I touch on that. We have a pretty extensive primary review process, and that review process is really limited by the number of faculty that we recruit to do a primary evaluation. And so we recruit faculty. This year, we're hoping for around 50 of our own faculty to review applications. Each of them gets about 20 applications or so. So that gives us really about 1,000 applicants that we can review pretty in depth. And we try to have I think what most people would call a holistic view of that review. Those reviewers only get the CV, personal statement, and letters of recommendation. They don't get any transcripts, they don't get the dean's letter, they don't get anything else. And so my view is, I want the faculty to be looking for people that have varied interests, they have a good communication skills, they have a demonstrated track record of being involved. And those are the people that we really want to try to attract. So once those primary reviews get done, I tell each of those faculty members to select 2 out of those 20 that they think we definitely need to interview. And then Dr. Villasenor and myself go through and just make sure there's no red flags for those folks, and then offer those folks an interview. So, I think that from kind of the invitation of an interview, that's how we go through and navigate our applicant list.
Great, thank you. Our next question is, as you know, many interviews are 10 to 20 minutes long. How do you weigh these brief interactions in composing your rank order list?
The interview, by far and away, for our program as well, I think most programs, is the most important part. And so about 2/3 of our score that we give each applicant is really based on those interview experiences. We have an average interview score that's based on the folks that interviewed that applicant. And then we have a committee score where the committee talks about all the applicants together, and we share our thoughts, and we give a committee score as well. So those 2 components really comprise the bulk of what the score is for each applicant. And the things that we're looking for in that interaction really is just mainly a human component. Is this somebody that I want to be on call with in the middle of the night? Is this somebody that I find to be interesting, intellectual, somebody that is going to be hardworking, trustworthy? Those are the things that we're looking for, because at the end of the day, we don't want to be taking call shifts with folks that we don't feel like we can trust them or want to be around them. And so that's really kind of the guiding principle for us, is when we're tired, when we're working hard, who do we want next to us? And then, the kind of the final piece with the kind of rank order list, we were very thoughtful in that whole process. As I said, the 2/3 of the score is based on the interview, but the other 1/3 is important. We really look at board scores, but again, it's a small component. We look at where do you rank in your class? We look at the things that you do. What do you volunteer for? What kind of leadership activities do you do? Do you have research experience? And so we want people that are well-rounded, people that are really interested in all facets of medicine and education.
That's great, thank you. Our next question is, what makes a successful resident in your specific program?
I think there are various attributes that make residents successful in any program. I think any program feels that a successful resident is somebody that really is interested in the field, right? Somebody that nerds out, if you will, on the topic. They love reading about it, they love learning about it, and they are excited about it. I think that's one of the most important pieces across the board, is that you really enjoy that material and the field itself. The other piece is just embracing being a trainee. I think it's tough for a lot of people these days, as we have a new generation of learners coming through, where they're, I think, sometimes feeling like, well, being a trainee, this is my job, but they're not really looking at how I can best utilize that time so that in the future, I have an easier time being faculty, being attending, taking care of my patients. Mm-hmm. And so I do think that there's this tendency for some people to come into training and say, well, I'm working too much, or I don't have enough days off, or I don't have this and that. And I think while that could be true in certain instances, don't put a whole lot of stress on that. Embrace being a trainee, try to learn as much as you can, or work as hard as you can. And I think for our program specifically, those that succeed the most do those things, and then they also are an active participant in our program. As I said, the people piece is what I love most about our program, and the folks that really thrive in our environment are those that are helping each other out, helping with recruitment. We have, unfortunately this year, with not being able to have people come and visit us, that takes out one component that our residents really love. Our residents really love those recruitment dinners. We don't ever cap the number of people that can go to those dinners. And so they would have their families and kids go to these dinners, and we would have our program outnumbering the applicants. And that was something that they all loved, they all wanted to contribute. And so those are the folks that succeed in our program, because they want to have that community feel, that family feel.
Mm-hmm. That's awesome, thank you. Yeah. Lastly, what advice do you have for those interested in anesthesiology but are not applying this upcoming cycle?
I think the biggest thing is to get experience. I think anesthesiology as a field, for most medical schools, it's really hard to get exposure. There are programs that don't have a third-year component to it. There are some that don't even have fourth-year curriculum through it. You have to get experiences at other institutions. And so I think that the most important thing is if you think you're interested, find those experiences, find those opportunities to shadow people, to get an exposure and see what it's like. I do think that that is one of the reasons why some trainees get a little bit disheartened, I guess is probably the best word, because it wasn't quite what they thought it was going to be. I think our field is wonderful. I'm obviously biased, but it's also difficult. It's also stressful. And I think those are pieces that people need to realize. And so the more experience you get, the more you realize that it's a multifaceted field, lots of different things that you have to be ready for and prepared for. And then, of course, getting to know people, getting to network, get to know faculty. You want to be thinking about, well, who's going to write me a letter of recommendation? And I think at your stage right now as a second-year student, now's the time, right? To think about when you go into your clinical rotations, who did I mesh with? Who is somebody that knows me well, that really saw my work ethic, really saw my ability to talk to patients, and can write a strong letter of recommendation. And then the last piece is just making sure that you do the best that you can academically, clinically. I think that as program directors and other people that are looking at applicants, that's how we try to separate people, right? How did you do in your classes? How did you do compared to your peers? I will say that, we look for people that are in the top 1 or 2 quartiles in their class, but that doesn't exclude those that are in the 3rd and 4th quartiles. But I think that you put yourself in the best position if you have great grades, great clinical rotation grades, obviously good board scores, and then you're well-rounded. I think those are things that we all strive to be, and if you can accomplish those things, all the better.
Well, awesome. Thank you so much for being here tonight. That concludes our questions. If you have anything else to add, you can say it now, but we really appreciate you coming on today.
I don't have anything else to add. This has been great. I hope that all of the applicants that have a chance to view this video and other videos really try to dive deep into the programs this year, because it's going to be a challenge to try to figure out, where you fit in and who you fit in well with. So I hope that the applicants really take that deep dive, because I know the programs are really trying to put their best foot forward and make sure that we give enough information so people can make informed decisions.
Great. Thank you so much.
Thank you.